The country and its healthcare system we are presenting today is a national health system in Cuba. Here's our agenda for our presentation today. Cuba's healthcare system is a national health system and is a single-payer, single-provider healthcare system. This system was created in 1961, and in 1976, universal healthcare was instituted. Cuba views healthcare as a right for all citizens, is a responsibility of the state, and social participation is inherent in the development of health services. There are no private hospitals or clinics, as all health services are run by the government. Cuba also relies on a model called the family doctor and nurse model. In this model, there are free services, a focus on preventative care, and essential to specific communities. Cuba has a long history of political turmoil and has been in the middle of several significant wars that has left the country economically and politically wrecked. Due to the unrest Cuba has been under, Cuba has not set up a structural national health care system until 1959. Pre-1959, Cuba's health services and facilities were concentrated in the cities, and the majority of these services resided in Havana, the capital. In this setting, there was extreme disparity between the urban and rural areas of available health care. Havana had almost half of the country's physicians. Havana had more than half of the country's hospital beds, and there was only one rural hospital in the entire country. In 1959, there was a mass fleet of physicians from Cuba, where 1,400 of the almost 6,300 physicians left for the United States for better opportunities. After this exodus, Cuba went from a ratio of 1 doctor per 1,064 people to 1 doctor per 1,268 people. Cuba then created a national healthcare system to better serve its population. In 1961, the national health system was founded. In 1976, Cuba includes Article 50 in the Constitution for universal health care. To ensure that universal health care is provided, Cuba works with various organizations like WHO and the Pan American Health Organization for funding. In 1983, the Family Doctor and Nurse Plan was initiated that was designed to provide individuals, their families, and neighborhoods with a team of practitioners that would both coordinate medical care and lead health promotion efforts based on the health problems in their specific areas. After 1983, Cuba's healthcare system remained pretty stagnant in terms of advancements. Cuba continued to focus on community health metrics, preventative care, and keeping the status quo through and after the Castro regime.
The current population of Cuba is over 11 million, with 76% of the population living in urban areas, a density of 102 persons per kilometer squared. The nation has a mixed heritage of Spanish, African, Asian, with an age structure that skews towards Middle Ages, with 71.1% of the population aged 15 to 64. Cuba's birth rate is almost 10 births per 1,000 population, with a maternal mortality rate of 53 deaths per 100,000 live births, and an infant mortality rate of 4.83. The current life expectancy is 77, almost 78 years, and the population has a fertility rate of 1.45 children born per woman. Children less than 5 years who are underweight are 3.9%. Cuba as a nation has health expenditures of 11.8% of their GDP, a hospital bed density of 5.9 beds per 1,000, and an adult obesity prevalence of 11.8%. Particularly interesting is the high physician density of 6,399 physicians per 1,000 population. Number of deaths in thousands can be seen on this chart, with heart disease, cancer, and central nervous diseases as the 3 highest. The political climate of Cuba is revolutionary socialism as a base, with a one-party system, the Communist Party, for many years, leading to political isolation, but the country does see healthcare as a constitutional right. Cuba has been affected by U.S. embargoes, which does affect technology, but politically can be very precarious. U.S. medical tourism has become a bigger point of concern on both sides of the countries, with medical diplomacy continuing to be strong, and Cuba training physicians that go to other underserved nations. The post-Castro Cuba is continuing to develop and will be the point to watch moving forward with Cuba. Economically, the country is disadvantaged comparatively, with an average yearly income. Sources range, but overall less than 19,000 US dollars per year. There is a large working age population, Cuba has a regionally low GDP per capita than the average developing nations, especially those in that part of the world. 8.8% of the GDP goes to healthcare. They're able to pay for medical care for full dependents, full pension for retirees, and those less than 20 years of age. Sociologically, the goal of the healthcare system is to expand care to as much of the population as possible, and they have largely reached this. Care provided by professionals who live in the community leads to more personalized approach to care at the community-based level. Medical and population education is a strong tenet, with a right-to-your-door approach, meaning the ability for physicians to provide house call services is much, much higher than it is in the United States. There's a focus on community-level health behavior and prevention, with many of the Millennium Goal measures either met or on their way to being met in the next few years. Technologically, it is a low technology system with many clinics still participating in pen and paper charting. Advanced imaging modalities are uncommon. Many clinics have limited internet access. Although regenerative medicine advancements have been seen in the area of bone marrow transplants and others, the Cuban health system still uses natural remedies that have been used for hundreds of years. Especially interesting is that of the hemophilia treatment. And there has been an increased U.S. influence despite embargoes. Tobacco use rates continue to be an issue in Cuba. It is seen as a healthcare and sociological crisis. Tobacco use is allowed inside public establishments, government facilities, and workplaces. Due to funding limitations, cessation products are not available, but consumer advertising is permitted across all mediums. There is distribution of free samples at public events, and Cuba has the third highest rate of smoking in the world. Another issue in the Cuban healthcare system is the aging population. Cuba has the fastest aging population in the Caribbean. They're expected that 30% of the population will be caring for the other 70% within one generation. They have been cutting services to deal with the smaller tax base in terms of shutting down hospitals and clinics, but this doesn't go very far to caring for that aging population. Subsequent outstanding concerns to the Cuba health system include economic insecurity, difficulty importing medical supplies for domestic manufacturing, medication shortages, and many of their healthcare facilities, while they're very easily accessed, are outdated and in poor repair.
All right. So the current Cuban government is the Communist Party of Cuba. Cuba has been under rule of the Socialist Political Party since 1959. That continuity in socialist structure in their government for that long period of time, part of what has led to the sort of stable, well-run healthcare system that Cuba is known for today. So there, the Cuban government is the sole provider and payer for healthcare in the country. In fact, the fundamental right to healthcare, as you'll see in this slide, is enshrined in the Cuban Constitution. That is the Constitution of the Republic of Cuba. That is considered a basic human right. And specifically, if you look towards the end there, you can see that not only is it considered a basic human right, but specifically stated as within the sole provision of the government to handle all the healthcare within that country. Right? So they provide free preventative routine and prenatal care primarily, or sometimes it's just very heavily subsidized. There are a few health-related device product stores. Even those stores are run by the government. They do sell products, although even within that structure, they still provide products free to low-income citizens. As well, the Cuban government takes care of education, pay, and housing for doctors and nurses who are considered government employees. Right, so as far as the governing entities, right, that socialist healthcare structure that covers Cuba is known as the National Health System. It was officially created in 1961. That overarching structure began the phasing out of any and all private healthcare related activities in the country. As we said in the former slide, within the Constitution, it specifically states that the Cuban government is to provide all such care and services. They also have the Ministry of Public Health. They provide or are the national oversight regulatory body with regard to vaccine and pharmaceutical activities, as well as various other hygiene, elderly disability, medical protection, and epidemiological services. It's also worth noting that their system that has that three-tiered community-based care provision integrated within the local communities. Even at that level, they have local government municipalities that are providing oversight to those functions. Right, so at this point, I think it sort of goes without saying a little bit that the orientation style for the healthcare system in Cuba is a social justice orientation, with that healthcare being considered a human right enshrined in their constitution, and it's saying, right, that government is to provide all of the funding for such. It's also worth noting that they took care to make sure there really is almost no market justice orientation in that constitutional provision does clearly state that the Cuban government is to provide all services. By implication, any free market capitalist sort of healthcare related ventures would not be legally allowed in that country. It's worth noting that they do have a lot of financial constraints because it is only government funded, leading to a lot of low costs and sort of antiquated facilities and systems and tools. However, that has forced them to focus on increased efficiency and effectiveness in service delivery, and their outcomes are therefore much higher because they've had to focus on that.
Public health is enshrined in its constitution, which states that every citizen has a right to health protection and care. Cuba has comprehensive universal health care, which is provided by the government. The single-payer, single-provider model is operated, financed, and administered by the government. This means that all doctors and nurses are government employees and that all medical facilities are owned and run by the government. And the national health system is financed by tax revenue. Every citizen has the same access to healthcare services under Cuba's system, and private healthcare is illegal. This is on preventative care and early detection through community healthcare and education, and coverage includes home visits, dental care, elective surgeries, which have long wait times, mental health, and expensive treatments and medications like chemotherapy and IVF treatments, both of which can be accessed quickly if the need can be demonstrated. For hospital patients is free. However, outpatient medication is not covered and must be paid for out of pocket. Over-the-counter medications like aspirin and ibuprofen require a prescription from a doctor or clinic. Medications are cheaper through government-run pharmacies, but there are often shortages due to the trade embargo with the U.S. Because of the embargo, there is a thriving black market for medications. So Cuban pharmacias also offer naturopathic products as well. Trade embargo, Cuba has developed a robust biotech sector with the goal to meet public health needs. It is 100% government funded and owned, and it helps to facilitate open communications and collaborate among universities, research centers, and the public health system. And this results in a faster overall process from research to trials and application. It has the capacity to produce 60 to 70% of the medications that are used domestically, and to date, it has successfully created multiple vaccinations for preventable diseases, and recently it has successfully created COVID vaccines, one of which was 92.3% effective against COVID. It has also created a cancer vaccine, which is currently in a phase 2 trial in the U.S. Population size, the government has placed an emphasis on maternal care. The 1963 maternity law gives women generous access to physicians throughout pregnancy, and it even mandates that women must take a total of 6 days off work for prenatal care. And it entitles women up to 18 weeks of fully paid maternity leave, and for an additional 40 weeks of maternity leave at 60% of their salary. It also requires regular well baby checkups during the first year of life.
Now we will discuss Cuban healthcare performance by looking at its cost, equity, access, and quality. In 2020, per capita healthcare expenditure was less than $1,200, or 10 times less than United States. Also, the percentage of GDP was 12%, which is also less than the United States. However, the low expenditure comes with some challenges. Low doctor payments have resulted in high immigration rate of healthcare professionals, and the healthcare infrastructure is in demand of renewal and replacement. Despite its low cost, Cuba provides a high quality care with a good life expectancy and a remarkable decline in infant and neonatal mortality since 1950s. In comparison to the United States, and considering the significant difference in healthcare expenditure, the quality of Cuban healthcare outcomes are even more remarkable in several aspects, including the recent performance of the healthcare system during the pandemic and a significant decline in cardiovascular and cancer death. With a focus on primary care and following the principles of equity, Cuba has provided excellent access to emergency and outpatient services for all Cubans. Cuba has more doctors and nurses per thousand citizens than many advanced economies, including the United States. Each primary care physician is responsible for about 600 to 700 patients, whom he visits about twice a year. He even follows them to the polyclinic when needed. However, unfortunately, the country suffers from frequent medication shortage, and concerns have been raised about freedom of choice for both patients and providers. Healthcare is provided for free to all citizens, even the most isolated and more vulnerable poorest patients. Some programs, such as the National Maternal Childhood Program and the aforementioned Family Doctor and Nurse Program, are internationally praised and provide a safety net for those in need.
Cuba's healthcare system is notable for its transformative approach to healthcare, which involves a range of innovative practices that prioritize health education, prevention, and community involvement. Here are some examples of how the multimodal approach and innovations are used in the Cuban healthcare system. First, one of the cornerstones of Cuba's healthcare approach is health education. Healthcare providers in Cuba work to educate individuals and communities about healthcare preventative practices such as healthy eating, hygiene, and regular exercise. The goal of this approach is to encourage people to take an active role in their own health and wellness, leading to a better overall health outcome. Cuba's healthcare system is also based on the principle of primary care as the foundation of healthcare delivery. Primary care is delivered through a network of community clinics staffed by trained professionals who provide preventative care, basic medical services, and referrals to specialized care as needed. To support its primary care model, Cuba has created a comprehensive set of infrastructure for healthcare delivery, including over 400 polyclinics, community hospitals, and specialized centers. This infrastructure ensures that patients have access to quality care no matter where they are in the country. Despite its limited resources, Cuba has also developed a number of medical innovations that have helped to transform healthcare both within the country and abroad. These include a lung cancer vaccine, diagnostic techniques for detecting diabetic foot ulcers, and a drug for the treatment of advanced prostate cancer. Cuba's healthcare system is also notable for its approach to disaster response. In the aftermath of natural disasters such as hurricanes and earthquakes, Cuba has a well-coordinated response system in place to ensure that people receive prompt medical attention and care. Overall, the multimodal approach and innovations used in the Cuban healthcare system have resulted in significant improvements in access to healthcare and health outcomes, especially among marginalized populations. Telehealth has become increasingly popular in Cuba, particularly in remote and underserved areas where access to healthcare services are limited. Cuba has equipped mobile units with state-of-the-art medical equipment that travel to remote communities to provide healthcare services. These units are staffed by healthcare professionals who can consult with specialists via teleconferencing to provide end-to-end healthcare services. Teleconsultations allow patients to communicate and consult with healthcare professionals from their own homes or local clinics using this video conferencing technology. This is particularly useful for patients who live in remote areas or have mobility issues. Cuba has also developed software tools that can be used to diagnose and manage diseases. These tools are designed to support medical professionals in their decision making processes by providing real time access to clinical information, evidence based guidelines, and patient records. And telehealth technology is also being used to support medical education in Cuba. Medical students can access virtual lectures, participate in online discussions, and engage in practical simulations to enhance their learning experience. Overall, telehealth in Cuba has the potential to improve access to healthcare services, reduce healthcare costs, and enhance the overall quality of care delivered to patients.
There are several areas of improvement that address cost, quality, access, and equity issues in the Cuban healthcare system. Firstly, in relation to cost, the government heavily subsidizes healthcare, which can be financially unsustainable in the long term. New funding sources such as public-private partnerships and implementing cost-effective measures to maintain the sustainability of the system could help alleviate this issue. The quality of healthcare could be improved by modernizing medical equipment and technology, as well as enhancing medical training programs for doctors and nurses. With regard to access, while healthcare is free and available to all citizens, access can be limited in some areas. Rural areas and marginalized populations have fewer healthcare resources available, and the government could invest in expanding healthcare resources for these areas and populations. While Cuba has achieved high health outcomes in areas such as life expectancy and infant mortality rates, there is still room for improvement. Preventative healthcare measures and early detection and treatment of chronic diseases could be improved to further improve patient outcomes. Finally, Cuba's healthcare system also faces equity issues. Some people may have more access to healthcare than others based on factors such as income, race, and geography. To address these, the government could invest in expanding healthcare resources for underserved areas and populations and ensure that healthcare policies and programs are designed to meet the needs of all citizens. By addressing these issues, Cuba can address and ensure that all citizens have access to high-quality healthcare regardless of their socioeconomic status or location. Several innovations and reforms have already either been introduced or are under consideration to address cost, access, equity, and quality in the Cuban healthcare system. Regarding cost, private healthcare providers have already been introduced to supplement the cost of the public healthcare system, as well as Cuba has a strong pharmaceutical industry, and because of this, the government is investing in research and development to produce new drugs and treatments. For quality, the Cuban government is investing in public health campaigns to promote healthy lifestyles, as well as increasing funding towards medical technology and the modernization of medical equipment, as well as the fact that the Cuban government is collaborating with organizations and countries worldwide in order to improve their internal healthcare system. Regarding access, expansion of primary care services and an increase in access to telemedicine aim to improve the access to healthcare to within remote areas. And for equity, the Cuban healthcare system has a strong focus on addressing the social determinants of health that contribute to health inequalities such as poverty, housing, and education. Investments in community-based healthcare programs that provide healthcare services and address social determinants of health in underserved communities are already being underway, as well as the government has implemented policies that provide universal access to healthcare regardless of income or social status, which promotes equity in healthcare access. An opportunity for improvement in the Cuban healthcare system is to enhance and expand the telemedicine program. This can be a cost-effective solution that will improve access to healthcare services in remote areas. Although the Cuban government already has tested several telemedicine programs, more investment and expansion can greatly benefit the healthcare system overall. One of the specific ways to improve the telemedicine program is by extending its use to mental health services, which are currently limited in availability and accessibility across the country. Providing mental health services through telemedicine will allow patients in remote areas or with limited mobility to access services they might not otherwise have been able to receive. To achieve this, the government should invest in improving the technology infrastructure for telemedicine, such as upgrading medical equipment and expanding internet connectivity in remote areas. Enhancing and expanding the telemedicine program will not only improve access to healthcare services, but also reduce healthcare costs and improve healthcare quality by increasing efficiency and reducing the need for in-person visits for certain types of care. Overall, this is a cost-effective solution that helps improve access, quality, and equity in the Cuban healthcare system. That concludes our presentation. We look forward to any questions you may have.